There's a new tactic for battling the opioid epidemic in our community. A two-person opioid response team with Colorado Springs Fire started today. Our Bill Folsom has a closer look at how they'll confront the issue.
Colorado Springs Fire Department responds almost daily to opioid overdoses. For that reason, they're working to counter the issue by starting a first of its kind in the state opioid response team. An emergency Colorado Springs fire response for opioid overdose will now get a rapid follow-up from the department's new opioid response team.
In their vulnerable state, we can provide that hope. We can provide that opportunity to say, hey, we have a solution that we can bring to you.
Netter is a master's level behavioral health clinician. Her partner, Clara Rucker, is a paramedic.
Anybody could be affected by opiate substance abuse, and we're here for everybody in every area of town.
The two will make contact with a patient their CSFD first responder colleagues had to help because of life-threatening overdose.
I bring the assessment piece, the clinical aspect of it.
My portion of the job will be to medically assess patients and determine if they meet our criteria to administer the Suboxone.
The medication is prescription.
But Suboxone actually gets into the body and takes the place of the opioids that are circulating in somebody's body.
It's a partner to Narcan, which is an emergency counter to overdose. Suboxone aids someone who wants to end addiction.
It does it in a way where it's a very comfortable process and doesn't cause harsh withdrawals.
We want to be able to do the connection, the mental health piece, the addiction piece, so that the rest of our folks are free to go save lives.
The opioid response team goes to people with addiction. Their red shirts are a signal they're offering help and not making contact for enforcement.
And what makes all of our programs, I think, so successful and unique is that we have the ability to go out into the community and meet them wherever they're at versus requiring them to come to us.
Data from recent years shows Colorado Springs Fire responding to around 270 overdose calls a year. The goal of the new program is to reduce the number of repeat calls.
This gives people the best opportunity that we know of to successfully get off of opioids and to really reclaim their lives.
Priority is making contact with people who have overdosed within the past 72 hours. If resources allow, they will go to others who request help. In Colorado Springs, Bill Folsom, News 5.
Bill, thank you. The El Paso County Board of Public Health says drug overdoses, both fatal and non-fatal, have become an epidemic over the past decade. I learned that in El Paso County, historically, more people have overdosed from meth or heroin. But in 2019, that changed as overdose deaths involving fentanyl started to increase. The latest numbers I found from the County Board of Health include fentanyl-involved overdose deaths from 2013 to 2022. And in this graphic, you can see the significant increase from 9 deaths in 2018 to 96 deaths in 2022. Overdose deaths involving fentanyl were 19 times higher in 2022 as compared to when this graphic was the date was first noted in 2013. If you or someone you know is facing a substance abuse disorder, you can call the Substance Abuse and Mental Health Service Administration's hotline number. The number is 800-662-HELP. It offers free information on local treatment facilities, support groups, and community-based organizations.